Styles of teaching. Part 1. Teaching with large groups. Learning objectives. The lecture and teaching with large groups. Advantages of the lecture. Problems with lectures. How to deliver a good lecture. The flipped classroom. The lecture and teaching with a large group. In larger groups, lecture can make a valuable contribution to the education program. Careful consideration need to be given to the reasons for their use and how they are delivered. It's the method most widely adopted teaching approach. The average of medical students sit through some 1,800 lectures in the course of their studies. Most will be quickly forgotten. Advantages of the lecture. Provide an entry into a different topic. Offer different perspectives on a subject, for example. Communicate relevant personal, clinical, or laboratory experience. Deliver a research-based view where teaching immersed in a research-intensive university. The lecturer can also meet with a large group of students and convey his or her passion for the subject. Serve as an introduction to a difficult topic and provide the student with a framework for their further studies. Provide different perspectives and at the same time relate the topic to the local context. Provide up-to-date information and highlight the contribution of research in an area. Used to provoke and discussions that encourage students to reflect on the topic. Include a practical demonstration, for example with a cardiac simulator. Provide students with the guidelines about their future study of the topic. Introduce the resources and other learning opportunities available. Problems with the lectures. Lecture may have many problems. Students in their own learning. Much of what is covered can be learned better from reading a book or engaging in an online program. The lecture is badly presented and difficult to follow with the visuals, overloaded with information. The content of the lecture is inappropriate for an audience and is irrelevant, too advanced, or too simple. How to deliver a good lecture then? First, get some facts in advance. Study the learning objectives for the course based on these. Consider how the lecture fits into the curriculum. Find out what the students already know about the subject of the lecture. Establish whether the lecture is one of a series of lectures on the subject and what the other lectures cover. Find out about the venue and the equipment to be used. Think about the content and structure. Plan the content for a lecture the students will wish to hear rather than the lecture you would like to give. create a title for the lecture, it is more likely to interest students if the title is in the form of questions, for example. Consider how you wish to structure the lecture, the classical method or the problem-centered approach. Choose the style you feel most comfortable with and which suits your personality. The introduction to the lecture. It is worth spending some time preparing your introduction. The first few minutes of the lecture are the most valuable. Try to capture the attention of the audience and highlight the importance of the contents of your lecture. An engaging start to a lecture might include a press cutting of a case where an error has been made in the management of patients. Using an interesting statistic highlighting the importance of the topic. Visual aids help to reinforce important points in a lecture, explain difficult concepts or principles in that case, help to vary the space of the lecture, maintain the student's interest. Video clips can be used to introduce case studies. Visual aids are a tool to help the teacher get a message across the student in most effective way. The lecturer note the PowerPoint slides should be the star of the occasion. The text on slides should complement what is being said, not replacing it. Engaging the audience. Introduce questions on the subject at various stages during the lecture. Students are asked to respond to the questions using an electronic response system or colored cards. Incorporate mini brainstorming sessions during the lecture where groups of 3, 4, or 5 students next to each other to discuss a topic. This is a key activity in a team-based learning. Introduce or build your presentation around a case study or patient management problem involving the class as a problem developed. Close of the lecture. The end of the lecture is almost as important as the introduction. Summarize the main concepts or message you wish to convey. Prepare the students for any further lectures that may follow in the series. Try to leave students with something to think about following the lecture that may stimulate a discussion with their colleagues. Handouts. If you want to encourage students to take notes during the lecture, make sure that you leave sufficient time for this activity. Flipped classroom. A significant development in recent years has been the concept of flipped classroom. The term was first used in 2007 by chemistry teachers Jonathan Bergman and Aaron Sams. They argued that students need to have their teachers present so that they can answer questions or provide help if there are aspects of a topic where difficulty arises. However, students do not need their teacher present in order to listen to a lecture or to review content. They proposed that in the flipped classroom, students watch recorded lectures for homework and then engage in further work and discussions in class with their teacher. Students require fact in the lecture. In traditional approach, following a lecture, students work individually or in a group to explore the topic and apply the information learned to practice. In a flipped classroom approach, students work individually or in small groups and acquire the facts. Then, in lecture setting, students explore the topic with their teacher. A comparison of the traditional lecture and the flipped classroom. Thank you very much.